current rating of 55%.
And to health matters, all 449 cholera cases in Bayelsa State, as recently reported by the Nigerian Centre for Disease Control, has been confirmed as cases of gastrointestinal diarrhea by the Bayelsa State Ministry of Health and the representatives of the World Health Organization. The ministry says the suspected cases returned negative after thorough test results of the patients, as against the report by the NCDC. Joseph Kunde has details.
Earlier reports from the Nigerian Centre for Disease Control included Bayelsa State as one of 31 states affected by the recent cholera outbreak in Nigeria, with about 449 cases. But a swift reaction from the Bayelsa State Ministry of Health and representatives from the World Health Organizations have contradicted the claims by the federal agency.
January this year, 2024, till date, there had been suspected cases of cholera, because most of the times when there is gastroenteritis, that's stooling and vomiting, a lot of people would think that it is cholera case. There are 449 cases of gastroenteritis that have been reported, and as I speak to you, there's none of these 449 cases that are turned out to be positive of cholera disease in Bayelsa State.
Our surveillance system in Bayelsa State is very strong, that no disease can escape without being detected. So as we speak, we don't have any confirmed case. What I will advise our people to do, whatever they keep at home to eat, they should wash it. Whatever they buy in the market, they should also look at it. The water they drink too.
However, the Director of Public Health, Bayelsa State, Yerin Stowe, says the state is not resting on the positive feedbacks, as enough mechanisms have been put in place to curb any outbreak in the state.
We still do not have, but that does not mean that we are just lying low doing nothing. We are being very proactive. We have ensured our heightened our surveillance across the communities, the world, in the state. And then we have deployed rapid diagnostic test kits to all of our sites, especially the communities that are hotbeds for cholera. So we are working around the clock to ensure that even if somebody comes down with it, the person can quickly be treated.
While the federal government has set up an interim ministerial committee to oversee the cholera emergency operation by the NCDC, the Bayelsa State government is carrying out community sensitization campaigns to prevent an outbreak in the state. Joseph Kunde, TVC News, Yenagoa.
Well, let's turn attention now to the cholera outbreak in the country and the controversy around whether or not there are cases of cholera in Bayelsa State. NCDC says there are cases, but the Ministry of Health, State Ministry of Health in Bayelsa says no. But let's get more perspective on this now. We're joined by Dr. Gbanabolu Orukari. She's the Director, Disease Control and Immunization, Bayelsa Primary Healthcare Board. Good to have you join us.
Thank you so much for having me. Good evening, viewers.
So why are we seeing this controversy around whether or not there are cases of cholera in Bayelsa State? Because Bayelsa State was listed by the NCDC as one of those with cases. Dr. Orukari, can you hear me? We seem to be having network issue. I'll just confirm once again if you can hear me. All right, Dr. Orukari, are you there? Can you hear me? All right, one more time. Dr. Orukari, can you hear me?
I can hear you now.
All right. I think there was a network challenge there. I was asking you why we're seeing this controversy around whether or not there are cases of cholera in Bayelsa State, and what is the true picture of things?
Thank you very much. Okay, actually, in Bayelsa State, between from the 1st of January, what we call week 1, EPID week 1, up till the EPID week 22, and even up till yesterday, Bayelsa State has been reporting cases of suspected cholera. So what happens is when cases present at the health facilities, we train our lower level health workers and hospital personnel, doctors, nurses, that when they see cases of gastroenteritis, especially frequent watery stool, we suspect we have a high index of suspicion of cholera. And so when that happens, they report it as suspected cholera. So when we have suspected cases of cholera, we now subject them to what we call the rapid diagnostic test. And that one further gives us a confirmation whether it's actually cholera or not. So we do the rapid diagnostic test, and then we have some positive. If it turns out to be positive, we now further subject that sample or that patient sample to a culture. And when we're able to culture the organism that causes Vibrio cholerae, then we can now confirm that we have a case of cholera. However, in all the cases that have been reported so far this year, none of them had tested positive to cholera. None of them had turned out culture positive. Yes, we've had some RDT positives, but none had turned out positive upon culture. However, so the cases that you are seeing on the NCDC website were cases of suspected cases, and most of them were reported in January, February, and March. They were not recently reported. So between January and yesterday, we had that number of reported cases, but it was not recently during this outbreak, cholera outbreak period. However, just this morning, we can confirm to you that we now got a positive culture. So as of today, we can say, yes, we have a case of cholera. We can say, yes, Bayelsa has a cholera outbreak that we are dealing with. However, from the cases that we've had so far, and knowing how cholera can be an issue in our environment, we have picked up all our efforts to ensure that we are not taking on our words. So our emergency operations center was already fully activated. We have commodities on standby. We have our case managers have been trained. Our health workers have been trained. So our surveillance system is fully prepared to pick up any case of cholera. So as of yesterday, we have suspected cases of cholera. But today we have had one positive. So that is the current situation of cholera in Bayelsa State at the moment. So
just to confirm now that there is now, Bayelsa State is now officially on the list of the states with the cholera disease. But I also want to ask you, what more are you doing? Because I know that, when it was COVID, when you find someone with COVID, you then do a lot of, trace back as to who this person has interacted with, how did this person get it? Is that also being done in this case?
Oh, yes. We even do that when cases are already, before they even get confirmed. So when we have a suspected case, we go back to the person's environment. We look at everybody, we look out for what we call active case search. So we look out to see if there are any person has similar symptoms, and we manage them at that level. So we are doing all that. We don't call it contact tracing because it's not a communicable disease, but we investigate every case that comes. So even all the suspected cases that you are seeing on the website have all been investigated, and actions have already been taken to handle them appropriately.
Thank you so much for your time. I guess now that there's a confirmed case, it lays to rest the controversy. Dr. Ogbanabolo Rukari, the Director of Disease Control and Immunization, Bayelsa Primary Health Board. Thank you for your time.
Thank you so much.